early on in my practice life, I realized that patients were frustrated with orthopedic care. They would spend countless visits at going to their family doctors, going to physical therapists, going to chiropractors, going to pain management doctors, getting an MRI in this facility, getting an X-ray in that facility. It was a very long, drawn-out process, and patients were very frustrated with the fact that no one was quarterbacking or coordinating their care. Some conditions, it would take them months to get a diagnosis, to get treatment, and to feel better. And we felt if we could create a facility where all of those disciplines, all those non-surgical orthopedic disciplines, are in under one roof, and all that care is coordinated, that we could get people better in weeks rather than months. So the end result is people are getting better faster, and they're spending time getting treatment and not wasting hours and traveling, waiting in doctor's offices to be told what their next step is.
Yeah, in a lot of physical medicine and rehabilitation practices or physiatry practices, a lot of times they're just prescribing physical therapy or doing pain management injections, seeing the patient in a couple weeks or even a couple months actually, and not really being able to follow firsthand a patient's progress within the program. What's nice about performance rehabilitation is that I'm literally right down the hall. I can monitor patients' progress in the therapy program. If they're not progressing, we can transition them to pain management quicker. At the same token, if they're in so much pain that they're not going to get any benefit from therapy because they're so guarded, we can move them along in pain management even sooner than that. So I think that's the best part about an integrated practice like this, that we can coordinate care under one roof and get patients the treatment that they need in a timely fashion.
Yeah, I think that's so great because, you guys know I've been practicing 30 years. And one of my biggest frustrations from a doctor's perspective is having those patients that have problems that are outside the scope of chiropractic, not knowing about it until they actually go to a pain management, orthopedic, or whatever discipline they're looking for those non-surgical approaches, and only to come to find out that I wish I would have known and had them under my own roof. So one of the exciting part of this for me is being able to have all these patients that have grown to trust me over 30 years, is to come into a facility that's not only well trusted in addition, but also to be able to do what I couldn't do for 30 years. So to me, it's just a win-win for everybody. And I'm so happy I got to spend some time with you last week, which was wonderful, just watching your procedure, your care for the patients, just your bedside manner. My patients are gonna love you. I mean, there's just no question about that. And this big guy over here, I've known for 15 years, so I know they're gonna love him, and they're excited.